Welcome back, everybody, to the deep dive, nosebleeds. Woo! We've all been there.
Oh, yeah.
A little trickle. You grab a tissue and move on with your day. But
Yes.
today, we're going way deeper.
Mm.
We're talking about the kind of nosebleed that can actually send you to the ER, posterior nosebleeds.
Yeah.
We dug into some pretty intense medical articles and even found some intriguing research on, get this, natural remedies. You ready to get a little blood savvy with us?
Do it. I think the first thing to really make clear is that this is not your run-of-the-mill anterior nosebleed. We're talking about something else entirely.
So help me picture this. What are we talking about here? What sends me running for the doctor instead of just a tissue?
Well, first of all, the bleeding is much heavier.
Huh.
And a lot of times it's coming from both nostrils.
Oh, wow.
And because of where it's happening, deep in the nasal cavity, the blood can actually drip down your throat.
Ugh.
So you might even find yourself coughing up blood or struggling to breathe or even feeling lightheaded.
Okay, yeah, that's definitely more than just a little nuisance bleed. So if it's not just dry winter air, what's going on in the body to cause this kind of intense bleeding?
Well, high blood pressure is a big one.
Hmm.
When your blood pressure is elevated, it puts a lot of stress on those blood vessels, and they can become weak and rupture.
That makes sense. But I would imagine the health of the blood vessels themselves has to play a role too, right?
Oh, absolutely. If you've got healthy arteries, they're going to be a lot more resilient, even if your blood pressure goes up a bit. But things like atherosclerosis, hardening of the arteries, that weakens the walls and makes them much more prone to bleeding. And even conditions that you wouldn't necessarily connect to nosebleeds, like liver or kidney disease, those can affect your blood clotting factors and indirectly contribute as well.
It's all connected, isn't it?
It really is.
It makes you wonder if even some common medications could be a factor here.
You're spot on. Blood thinners, while essential for some people, definitely can increase the risk of nosebleeds. It's all about finding that balance, managing one condition without making another one worse.
Yeah, you've got to weigh those risks and benefits for sure. It makes you realize how important it is to talk to your doctor about any unusual bleeding, even if you think you know what's causing it.
100%.
Now, I also saw something about structural issues in the nose, like a deviated septum being a possible cause.
Yeah, that's right. If your septum, that wall that divides your nasal cavity, if it's deviated or crooked, it can disrupt the airflow in there and make certain areas more prone to drying out and irritation. And in some cases, which thankfully is much less common, a tumor in the nasal cavity could also be a factor.
Okay, so there's a pretty wide range of potential culprits here.
Yes.
Are there ways to pinpoint the exact cause if it's not immediately obvious?
Well, doctors will typically start with a physical exam, of course,
Mm-hmm.
and they might use imaging scans like a CT or an MRI to get a better look at the nasal cavity.
Mm.
Blood tests can also be really helpful. They can look at your clotting factors, liver and kidney function, and rule out other underlying conditions. But sometimes, even after all that, the cause remains a mystery. And in those cases, it's what we call idiopathic, meaning we just don't know for sure.
So a bit of a medical mystery.
Right.
But let's get practical here. Someone's at home and this happens. What's the first thing they should do?
Well, the basics are the same as with an anterior nosebleed. Sit upright, lean forward a bit, and pinch your nose just below the bridge, applying firm pressure for 10 to 15 minutes.
So the classic remedies still apply.
Absolutely. An ice pack can also help constrict those blood vessels. But because posterior bleeds are more serious, it's even more important to act fast and know when it's time to get help.
When do you know it's time to head to the doctor or even the ER?
If the bleeding doesn't let up after 20 minutes of constant pressure, that's a big red flag. And if you start experiencing any of those more serious symptoms we talked about, like dizziness, difficulty breathing, coughing up blood, then you need to get medical attention right away.
Don't mess around with that stuff.
Exactly. Better safe than sorry. And the good news is there are medical interventions available if those at-home measures don't work.
Okay, good to know. So what are some of the options? What can doctors do to stop a posterior nosebleed that's really stubborn?
One common procedure is nasal packing. They'll basically insert gauze or a specialized sponge to compress the bleeding vessels.
Is that what they do after surgery sometimes? I remember my grandmother having that done years ago after nasal polyp removal.
It is. It's a tried and true method.
Yeah.
And then there's cauterization, where they use heat or a chemical solution to actually seal off the bleeding vessel.
Mm-hmm.
And for more complex cases, they might use a technique called angiographic embolization.
Okay, that one sounds pretty high tech. What's involved there?
Well, imagine a plumber sealing a leaky pipe by injecting a sealant. Angiographic embolization is kind of similar. Using X-ray guidance, they inject a material that blocks the specific blood vessel that's causing the bleeding.
Wow, so they can target it directly?
Ex-
That's amazing. But of course, it would be even better to prevent these nosebleeds from happening in the first place. What are some steps people can take to reduce their risk?
You're right. Prevention is always key. And we've already touched on managing blood pressure and making sure you're taking blood thinners as prescribed, but it goes beyond just medication.
What are some other lifestyle things that come into play? Besides the obvious, like don't pick your nose.
Right. Well, staying well hydrated is huge, especially in the winter when the air is dry. Keeping those nasal passages moist helps prevent irritation. And treating sinus infections promptly can keep them from spreading and causing inflammation. And, even something as simple as using a humidifier can make a difference.
It's amazing how those little things can add up. But I have to ask about that natural remedy you mentioned before, the honey.
Oh, yes. Our research kept pointing to honey as a potential player in managing these posterior nosebleeds. It's been used for centuries for all sorts of things.
Intriguing.
And its properties, it's pretty amazing what honey can do.
All right, I'm hooked. Tell me more about this honey factor.
Well, honey, it's naturally antibacterial, antiviral, even antifungal, and it's a powerful anti-inflammatory.
Mm.
And there's research that suggests it can actually promote wound healing and help regenerate tissue.
Wow.
So you can see how those properties might be really helpful in soothing irritated nasal passages and speeding up the healing process.
Yeah, that makes a lot of sense. But how do you even use honey for a nosebleed? Do you just stick your face in a jar of honey?
No, not quite. There are a couple of methods. One involves mixing honey with some warm water and creating a solution that you can use to rinse or gently irrigate your nasal passages.
Oh, okay.
Another method is applying a small amount of medical-grade honey directly to the affected area using a cotton swab.
Medical grade honey. Is that different from the stuff I have in my pantry?
It is. Medical-grade honey is specially sterilized to make sure there are no impurities and that it's safe to use medicinally. It's also often tested for its antibacterial potency.
So not just any honey will do. Are there any risks with using honey in the nasal passages, though? Even the medical grade kind?
Generally, it's considered pretty safe.
Mm.
But as with anything, there's always a chance of an allergic reaction. So it's really important to do a patch test first. Put a tiny amount on your skin and see if you have any reaction before putting it anywhere near your nose.
That's good advice for anything you're trying for the first time, really. And of course, talk to your doctor before starting any new treatment, especially if it involves a sensitive area like your nasal passages.
Absolutely. Always a good idea.
So, honey, it's promising, but is there enough research to confidently say that it isn't ineffective for posterior nosebleeds?
That's the question, isn't it?
Mm-mm.
There's lots of anecdotal evidence, and it's been used traditionally for a long time. But we need more scientific studies, rigorous ones, to confirm if it really works for this specific problem. It's definitely an area that needs further exploration.
So, a promising avenue, but not a definitive solution just yet. It all comes back to those proven prevention strategies we talked about earlier, keeping those arteries healthy and strong.
Exactly.
It seems like maintaining good overall health is really the key here.
Absolutely. It all works together.
Mm.
And taking good care of your body can lower your risk for so many health issues, not just posterior nosebleeds.
It's about getting to the root of the problem, not just putting a Band-Aid on the symptom. So let's remind our listeners about those key prevention strategies again. What are the top things people can do to keep those nosebleeds at bay?
The first one, the big one, is managing your blood pressure. We've talked about how high blood pressure can weaken blood vessels. So things like exercise, a healthy diet, especially one low in sodium, and stress management, all those can help keep your blood pressure in a good range.
And if lifestyle changes aren't enough, then medication might be necessary.
That's right.
It's crucial to work with your doctor to find what works for you. What about those other medications that we mentioned, the blood thinners? Are there any alternative options if someone is getting frequent nosebleeds?
That's a great question to bring up with your doctor. They can look at your specific situation, your risk factors, and see if adjusting your medication or finding an alternative is possible. It's about carefully weighing those benefits and risks.
It really highlights how important that open communication with your doctor is.
It is.
Don't be afraid to talk about any concerns you have.
Exactly.
So what else can people do? I imagine wintertime is especially tricky with the dry air.
Oh, it is. It's so important to keep those nasal passages moist, especially when the air is dry. So a humidifier, especially in your bedroom, that can make a huge difference. And saline nasal sprays, those are really helpful too.
Are those over-the-counter saline sprays basically the same as the nasal irrigation stuff that people use for allergies?
They are. Nasal irrigation with a neti pot or one of those squeeze bottles can really help clear out allergens, irritants, mucus, all of that, which reduces inflammation, and that can help prevent nosebleeds.
It sounds like there are a lot of different things people can try,
There are.
from simple lifestyle tweaks to more serious interventions. But the bottom line is, be proactive, take charge of your health. Is there anything else people should keep in mind when it comes to preventing these nosebleeds?
Avoiding irritants is huge. Smoke, dust, strong fumes, all of that can irritate those delicate nasal passages and make them more likely to bleed. So if you can't avoid them altogether, wearing a mask can give you that extra layer of protection.
That makes perfect sense. It's all about minimizing those risk factors whenever possible. We've covered a lot today. We talked about what causes posterior nosebleeds, how to deal with them when they happen, and how to try to prevent them in the first place. So what would you say are the most important things for our listeners to remember?
Well, I think the main takeaway is that posterior nosebleeds, as scary as they can seem, are manageable. Understanding the causes, recognizing the warning signs, and taking steps to reduce your risk, all of that can make a world of difference.
It's true. Knowledge is power, especially when it comes to our health.
Absolutely.
And if you do have one of these nosebleeds, knowing how to respond and when to get medical help can really prevent complications and make sure you get the right care. Any final words of wisdom you want to leave our listeners with?
It really has been fascinating, hasn't it? What really struck me is just how many different things can cause these nosebleeds.
It is. We tend to think of them as such a simple thing, but like you said, it can be a sign of something much bigger going on.
Right. It's like a reminder to really pay attention to what our bodies are telling us.
Yeah, don't ignore those signs.
Even the seemingly small ones. Because a nosebleed, especially if it keeps happening, it could be your body's way of saying, hey, something's not quite right here. Let's investigate this.
Like our bodies are trying to send us a message.
Exactly. And it's up to us to listen to those messages and get help figuring them out when we need to.
Speaking of getting help, what's one question you think our listeners should be asking themselves or their doctors if they're dealing with these posterior nosebleeds?
I think a really empowering question to ask is, what can I do to take control of this? Because it shifts the focus away from feeling helpless and puts you in the driver's seat.
I love that.
It opens up a conversation about what lifestyle changes you can make, what might be causing these nosebleeds, and what you can do to prevent them.
Be proactive.
Exactly. You're not just passively receiving care, you're actively participating in your own health.
Collaborating with your doctor to come up with a plan that works for you.
Yes.
It seems like awareness is really key here. Being aware of the potential causes, the warning signs, and knowing when to get professional help.
You got it. And that's really what we've tried to do today, to give you the information and the tools you need to feel confident and make informed decisions about your health.
It's been a real eye-opener for me, and I hope our listeners feel the same way. It's amazing how something as simple as a nosebleed can turn out to be so complex and fascinating when you really dig into it.
Right. It shows you how interconnected our bodies are and how many different factors are at play when it comes to our overall health.
And that, I think, is the beauty of these deep dives.
It is.
We get to explore those connections, uncover the mysteries, and arm ourselves with knowledge.
Knowledge that can ultimately lead to better health and a greater sense of control over our bodies.
Couldn't have said it better myself. Well, on that note, we're going to wrap up our deep dive into the world of posterior nosebleeds. We hope you found this episode insightful, empowering, and maybe even a little inspiring.
Until next time, keep exploring, keep asking those questions, and keep diving deep into the amazing world of your own health.
And remember, if you're ever dealing with a nosebleed that just won't quit, don't hesitate to reach out to your doctor. They're there to help guide you and get you back on track. Thanks for joining us on The Deep Dive.